Gracias por mantenerse en sintonía a este su programa Houston Salud y Cultura. Es para nosotros un motivo de orgullo y placer el poder contar con nosotros hoy la presencia del Dr. Gregory Lance Tarzan Smith. El Dr. Smith es un especialista cirujano plástico famoso y reconocido a través de todo Estados Unidos, en que ha practicado mucho tiempo, no tanto en Hollywood y con grandes artistas, pero también con muchos pacientes. El Dr. Lance Smith nos va a hablar porque él también es un sobreviviente del cáncer y además participó en la serie Survivor, la cual requiere un gran esfuerzo físico, y es para nosotros un motivo de alegría el poderlo traer como paciente del Dr. Mark D'Andra y que nos dé su historia. Thank you for being with us, Dr. Lance Smith. It's for me, it's a great pleasure to have you in our show.
Thank you.
We understand you are a plastic surgeon.
Yes, I'm a board-certified plastic surgeon. I do microsurgery, and I was a general surgeon as well.
And doctor, can you tell us a little bit about your career and what brought you here?
Well, originally I was in practice for about 30 years in Houston, and I developed a lymphoma, and I went to a hospital, and I was told that I would live perhaps another year or two. And since I was working about 90 hours a week, I decided that I might use that time to live a little bit longer, so I stopped my practice. It was a prolific practice, and it was my entire life, but I thought that I'd use that time to do some living other than what I had been able to do practicing 90 hours a week. And so one of the doctors that I knew that was a friend of mine noticed I wasn't in surgery any longer, and he gave me a call and discovered that I had quit because I thought I was going to die within a year or two. And he recommended Dr. D'Andrea. So I had a consult with Dr. D'Andrea, and where I had no hope, Dr. D'Andrea's bedside manner gave me hope, and also hope for my wife of 30 years. And so I decided to have Dr. D'Andrea help me. He radiated me, and for the last 9 years, I basically am totally free of cancer. And in fact, even though I'm 64 years old, healthy enough to go on a pretty rigorous program that they call Survivor, a adventure program here in America.
Doctor, and I want you to explain for the benefit of the viewers at home, you're a medical doctor, you're a surgeon, and you were told that you have 1 year to live, and you totally freaked out till you found Dr. D'Andrea. Can you imagine for a normal lay person like us? What can you tell us about that?
Well, the reality is normally a person who discovers that they have a deadly disease that may kill them, they usually go through a number of psychologic stages, which normally are about 5 stages. But as a surgeon, I've seen so many people in a similar circumstance that I went straight from realizing I had a dire diagnosis in which I may die within a year or two to accepting it. I accepted it, and my thought was I want to live as happily as I can while I'm still breathing, and I wanted to make it as easy on my wife as I possibly could. And in my mind, the best way to handle that was to stop the practice and begin enjoying some other things about life.
Wonderful. Dr. D'Andrea, when it must be difficult to treat a fellow doctor.
It is.
When he came to you and told you that other doctors have told him he had 1 year to live, what did you do?
Well, obviously, it's difficult to sometimes convince a expert in their own field who likes to have a lot of control of their life about something that they may not know everything about. Dr. Smith is a very articulate and very intelligent person, so first thing I had to let him know that I understood his position where he was told he was going to die. I wanted to review all the material that he had taken to the other institution, which I did, And then I discussed with him my experience and the experience literature of this disease, and explained to him in a very educated way that he could understand what the outcomes could be if he allowed me to treat him.
And Dr. DeAndrea and Dr. Lance Smith, this is, you were told 1 or 2 years, and how long ago was that?
That was about 9 years ago, and I'm basically free of cancer. I don't have cancer at the moment that I'm speaking.
Dr. DeAndrea, if I'm not mistaken, Dr. Lance Smith was told about 10 years ago that he had 1 year to live. Is that correct?
That's correct.
That's correct, Dr.
Yes,
Smith. And here you are 10 years later on this show, and you have been in Survivor, which require an extreme amount of physical fitness and condition.
Well, endurance.
Endurance.
Yeah.
So
you starve and you don't sleep for about 39 days, so pretty tough.
So basically, are you God, Dr. DeAndrea?
No way. I'm thank you for the compliment, but no, I'm not. I have nothing to do with that. I do ask guidance from God. Obviously, I am a Christian person, but basically, I was trained for very well, and I use my experience and literature and some common sense to treat my patients. A lot of times, unfortunately, people will go to larger institutions such as Dr. Smith. Because they want the expert opinion, and some very esoteric or unique cancers are not very common. Even larger institutions don't have a lot of experience. So what we have to do is use our talents that we're given and literature, and put all this information together using the art of medicine and the science of medicine, and then using your brain to integrate all these and provide a treatment, which I did for Dr. Smith.
Dr. Lance Smith, due to the fact that you are a world-renowned, famous plastic surgeon and a physician, what can you tell the viewers that are diagnosed with cancer?
Well, the primary thing about this is to keep your faith, believe in providence, and that the most hopeful thing is to realize that, in my mind, certain things are meant to be, and they end up favorable even when they seem they may not otherwise be favorable. And just live every moment to the fullest and let nature take its course.
Thank you. Sounds like a very sound advice. You as a physician, do you treat yourself?
All the time.
with or without Dr. DeAndrea's consent?
Well, I keep, in a sense, I keep Dr. DeAndrea in my back pocket. You know, I don't rely on myself totally, but in general, I use my own acumen, medical acumen, with regard to taking care of myself as far as I can take it.
Doctor, it seems like you have done a great job, almost miraculously, for Dr. Lance Smith. Do you do that to him because he's a famous plastic surgeon, or do you do that to all your patients?
All my patients are famous to me. All patients have the same wonderful life story, just as Dr. Smith does. But we have many patients who were told they only have a few months or years to live. We're able to help a lot of them live longer than their prognosis or their what they were told. We do not cure everybody. Unfortunately, I would love to say we do, but I believe we do make people more comfortable, and we do prolong their life and give them some dignity and also some good quality time while they have left.
And I would say I back that up. I sensed in Dr. DeAndrea that he's a compassionate guy, a very smart oncologic radiologist, and the reason that I went ahead and allowed him to take care of me was that I developed a tremendous amount of respect and appreciation for him as a human being. Very compassionate guy, treated me better than I'd been treated by any other physician, even though all the other physicians that had seen me knew that I was a doctor. But he, in my mind, was the best. And in my mind, he did save my life. I wouldn't be sitting here today if it hadn't been for him. And if it hadn't been for him, I wouldn't have been able to enjoy being on Survivor.
Can you tell us a little bit about
Yeah.
Survivor and your experience, and where did you go?
Well, this was season 24, the last season, and we went through Fiji to Samoa. We stayed on Samoa for 39 days, and basically you starve, you don't sleep. I lost 25 pounds. You have to boil your water or possibly incur a parasite, and you have to start your own fires the old-fashioned way, the antediluvial way. So it's a very austere experience, but enjoyable if you enjoy the adventure of it all. So I had a wonderful time in this program, surviving.
Dr. Len Smith and Dr. DeAndrea, can we say safely that we do not have an expiration date?
I think that's really true. I remember as a very young resident learning a life lesson. A patient came in and was very angry, and being young and the patient was older than I was, and I didn't want to offend him, but I said, "You seem angry." And he says, I said, "But why are you angry? Other than, I understand you have cancer, you're angry." He goes, "Well, a surgeon told me I had only so much time to live, and I'm alive a week longer." I said, "Well, maybe not everybody has the answers, and we shouldn't look at a timetable." And sure enough, that man did very well and lived many, many more years. So, long story short is, and this was a long time ago. So, long story is, we do not have an expiration date. As I tell all my patients, God has a timetable for us. It's not what I want. It's not what you want. It's what's in our destiny by God's plan for us. So basically, when He says you're coming, I can't stop Him. So,
and if you believe that, it makes everything much easier to accept.
Yes, I want to thank you, Dr. DeAndrea, Dr. Len Smith, and also I would like to take this opportunity to invite you to come again to our show. There's so much that we need to talk, especially coming from a famous, renowned physician like you, and also to Dr. DeAndrea, so we can teach the people that are seeing us at home, and coming from the perspective from such a famous doctor, they know that this can happen to the rich and the famous, or to me, or to them.
Thank you.
Thank you so very much for being here with us, and I hope to see you again.
Oh, thank you. You too.